Hi, my name is Joanne. I've been a patient with Regional Hospice now for several months. I can tell you that everyone I have come in contact with at Regional Hospice has been caring and compassionate, and I am finding that they are helping me in ways that I never even imagined. The decisions that I have had to make over the last several months regarding my care, not just my medical care, but emotional decisions, different things. So it's nice to have the loving, caring, compassionate people at hospice to give you another perspective to look at and think about. They can't make the decision for you, whatever it may be, but they give you choices and help me to make the right decision for myself and my situation.
When we brought Joanne home, we wanted her to be in our home environment where she could be surrounded by her friends and family, and hospice made that possible. I mean, they had everything in place, from the hospital bed to the medical supplies everything she could possibly need, they took care of. Hospice was there anytime, day or night when we called. We would either speak to a nurse or a doctor. It was like an extension of family.
And it's demonstrated with the way they take care of Joanne. The love that they show is just very comforting, knowing she's getting the care that she really needs.
I would say that in hospice social work, it's really kind of broad. There's probably two main categories. One is really more what I think of as like the concrete kinds of things that people need. So like for instance, when Joanne first came onto our program, the focus, especially on my part, was really at looking at what kind of systems needed to be put in place in order for her really basic needs to be met within the setting that she was going to be living, which was her sister and brother-in-law's home. Once that part is accomplished, then it really does, you can move on from there. Then you can look at, what are some of the emotional ramifications of, both dealing with an illness, not exactly sure, what choices and what treatments, if there's still treatments that are available. And oftentimes, those are not curative treatments, but you're looking at, palliative treatments, ways of, helping to not only feel better, but to cope better too. And, we tried to, at Regional Hospice, accomplish that through, really working closely as a team, and each of us, being able to offer something different, but yet together, and provide that person and their family with as much support as we can.
As a nurse case manager for Regional Hospice, it is my primary duty to come in and to assess the patient each time I visit. Our patients have needs and symptoms that change, sometimes several times a day, and they need to be addressed and taken care of at that time. It is also a function of the nurse case manager to interact with all the other disciplines in our organization, the medical social worker, the pastoral care department, the volunteers, and the home health aides. We coordinate a schedule to meet the patient's needs and follow through to make sure that those needs are met. In the course of the past couple of months, Joanne improved, so we adjusted the care that we give to fulfill what she needs at the time.
I love to come into your aunt's house. You can feel the love in the air, and she's a very special lady, and I love her so much. She's my teacher, she's my patient, she's my friend, and every day is something different. We are there for the patient.
I want to say thank you to everyone at Regional Hospice for helping me arrive at this point in my care and in my life.